Hello everybody. First of all, I'd like to thank Wound Care today for giving me the opportunity to present a small case study to you. I first saw something called the Moleculite bacterial scanner at Wounds UK last year, and I don't know about you, but as a tissue viability nurse, I've been a TVN for a number of years now, and we get quite a number of companies approaching us with new innovations, another foam that does something more than the foam that you're using, etc. So when I saw this, I thought this was a really interesting addition, could be a really interesting addition to my toolkit for wound assessment. Now, I know some of the TVMs out in the audience will say, well, actually, I know what a wound infection looks like because I look at the clinical signs of the patient. But I just want to show you a patient that I was involved with where actually you couldn't tell whether they had a wound infection at all. And I would never have known, apart from the wound wasn't healing in a timely fashion. So the first slide I have to show you is to say that I had no financial support with this. I purchased a Moleculite for my trust. I went to the innovation panel to be able to purchase it. So I've had no financial support at all in this, with this case study. So when I first met this little boy, it was Friday afternoon, as it always is. Phone call from the paediatric outpatients department to say, can you come down to outpatients because we've got this little baby. We've taken the boots off of him, and there's a massive ulcer underneath it. Can you please come down? So down I went, and I met this little boy who at the time was a couple of months old. So he was born with talipes. And he's undergoing a long period of time with the boots and correctional boots that they have to wear. So he was a long time in these boots, and you can see from the picture that's what the boots look like. So trying to keep a young baby still for 5 minutes is very difficult anyway. And also, in my experience of children, they heal very quickly. They tend to turn a corner. So you spend time healing them, then they turn a corner, then they go on to heal quite quickly. With this little baby, he still had the pressure. The problem was still there. So we had it was a delicate balance between, do we remove these boots? And then he goes back in his treatment. His tendons start to tighten up again. He has to go back into casting. Or do we carry on trying to heal this wound, but reduce the amount of time that he was in the boots? So we tried a bit of everything, really. So initially, we kept the boots on. The Moleculite, I don't know whether anybody's seen it. I know it's on the Smith & Nephew stand at the moment. It looks like this. And you turn it on. I'm just going to show you what it looks like. Probably won't be able to see it in the light. But basically, you turn it on, you can take pictures with it, and you can measure with it as well. But it only fluoresces when you actually turn the lamp on. So the lamp, you might not be able to see, is violet light. You have to have a dark room, and if you don't have a dark room, the best way to do it is to, they give you a hood it's like a lamp, I call it a lampshade. And you put that over the wound, and then you can take your pictures and scan the wound from there. So if there's an infection there, or a bacterial burden 10 to the power of 4, it will glow red. And sometimes it really lights up like a Christmas tree. So half of you thinks, oh, damn, I found something. And the other half of you thinks, oh, it's glowing. So I use this visual to help me with my diagnosis. Because actually, if this baby is showing no signs of clinical infection, then why would I apply a Moleculite to his wound? However, with a baby who's 4 months old, sometimes you can't tell. They have a pyrexia, they're grizzling with pain because they're teething. So is it the wound that's the problem, or is it normal baby grisliness. So I took the molecular along the second time because I didn't have time the first time. We applied the moleculite, and applied the moleculite to it. And you can see there, because if you think the boots are still in place, so the reason for the pressure is still in place. We can't remove it at the moment because his treatment would be compromised. Rather macerated after 2 weeks. Did start off with honey because we use a lot of honey in the IUH. And you can see there, because those boots are still on, he's got a hot, sweaty foot. Mum likes to wear baby gap socks. I don't know if anybody's got babies who've had baby gap socks, big, thick, toweling socks. And also these boots and bars have to go on and off during the day and the night as well. So lots of challenges with this little baby. So if you look at the visually, you would look at the wound on the left and say, well, it's not particularly infected, a bit macerated. But actually you can see from the moleculite image that actually it's looking okay. There's no bright red glowing infection there. So that's after 2 weeks. Then it's started not healing the way that you would expect it to heal. So what you're then thinking is, well, why isn't it healing? And actually the surprise was that it was the surrounding skin that was infected. So we did targeted swabbing. We swabbed the surrounding area and it came back with Staph aureus. So the baby did have a week of antibiotics. We took everything off, all the boots off, everything, so knowing that he may go backwards with his treatment. And actually it gave the ulceration some time to heal. Which you wouldn't have seen that from if you'd used the naked eye. I think you could probably agree with that. So using my wheel, there you could see that you've got the red, but also there are areas there that if you've got a bright white light, that often can indicate Pseudomonas as well. So lots of challenges there for this baby. So when we removed the boots, a week later, you can see there's an improvement there generally in the wound as well. I wasn't expecting it to heal overnight because he's still a very active little baby. So you can see that there's an improvement in the wound there. There's always that worry, though, that you're going to affect their end treatment. The parents, they liked the use of the moleculite because they could see when there was an improvement there. And when I've used it in other patients, the patients get quite involved with it. And often it's not what you don't see, it's almost as important as what you do see. Almost healed, surrounding skin still, I think a lot of that is flaky skin, because bearing in mind he's still quite perspiring, and by then he had his boots back on, because we only did a week without them. Then the parents have started to increase the time that he's wearing his boots. And by the time, after 10 weeks, it's healed, that's virtually closed over. And I haven't seen him again. The parents I got a Christmas card from him. Amazing, you can write it 4 months, but I'll take that. But I had an update because he's not being looked after by nurses, he's actually being looked after by therapists. So they gave me an update on the baby. Because I was thinking, is this going to be hell for him? Because he's going to have to keep something on his feet for quite a long time, possibly even years. And they said that it hasn't come back, that he has healed and stayed healed, and that he comes to the Talipes Stay and Play, which I think, I want to go to that as well. And they said that they felt, because this is only the second one they'd had ever, they felt it was probably due to 2 little spurs that he had on the end of his heels. And also the parents, I think, were struggling with actually putting the boots on firmly enough. So it's really good that, I was able to show them that there was an improvement in the wound. For me, certainly, from the naked eye, I would never have known that surrounding skin looked like that at all. And that, I needed to treat that rather than the actual wound itself. So thank you for giving me the opportunity.